Dr. Kevin Cavanaugh is a retired physician, also founder and president of a national organization called Health Watch USA. Dr. K joins us now. Hey, good morning.
Hey, good morning, Jack.
I want to promote your event that's coming up here in the not too distant future. Tell us a little bit about what Health Watch USA is all about, and then tell us about your conference.
Well, Health Watch USA is a nonprofit organization that's dedicated to promote research integrity, especially in infectious disease, and also for patient advocacy for better quality and lower cost of healthcare. And on June 15th, Health Watch USA, along with the Massachusetts Nurses Association, is having a large international webinar. We have a number of speakers from around the world coming to talk, both from places such as England, Australia, Singapore, Spain, Germany, and even Kenya, to really hear about what is going on in their countries regarding COVID-19. And I can give you all kind of a spoiler alert here that it's the same as what's going on in this country. This is not a hoax. It's not a political type of a conspiracy. The virus is real, it's dangerous, and a lot of countries are very concerned about it. Our keynote speaker is Carolyn Clancy, who is the Acting Deputy Secretary for the Veterans Affairs. And we are extremely privileged to have her and think it is going to be an excellent event. You can go to a website, which is healthconference.org, www.healthconference.org, to learn more about it and to register.
Excellent. Well, we'll remind people of that a few more times between now and then because we have a little distance, but I just thought we'd at least get that word out this morning. Now, the CDC's kind of backed up on their statements concerning cleaning surfaces. Can you fill us in on that?
Well, they did, and I feel almost vindicated because, as you know, we have been saying from the get-go that this virus has a lipoprotein capsule and that it should be very susceptible to the use of soap. The soap should actually kill the virus, let alone mechanically remove it. And that's what I do personally. I use soap and water whenever I can as opposed to disinfectants. And the CDC released a statement stating that for cleaning surfaces, detergent, soap, and water are probably going to be okay, and also stated that they may also weaken or damage some of the viral particles, which again goes along with detergents interrupting and dissolving that phospholipid capsule, the virus. So the CDC has given the okay to cleaning surfaces with detergents as opposed to antiseptics. I think that's very good. Of course, you still should carry some hand sanitizer with you because you're not always in an area where you have soap and water or even the water to wash off the soap off your hands. And so 70% alcohol is great, and that's something that you should use. And of course, always wash your hands for at least 20 seconds.
Have you any information regarding when the J&J product is going to be once again available and those shots will be delivered?
Well, from what I understand, it may get approved again come Friday. I think that there may be some restrictions simply because I consider this a misstep. And of course, you're going to have to do something when you do this and put such a pause on it. And so hopefully by next week, because this is such an important product, it's just a single dose. People have difficulty getting to the doctor's office, especially in rural areas. This can be a big thing. They don't have gas money, don't have a car. To have to do this twice is very, very cumbersome. And Jack, this product needs to get into the hands of the providers. And I should also add, they don't have ultra cold storage in many areas in rural Kentucky. So product is key. So hopefully this will be back online next week. And as we said before, this is for 1 hospitalization, 1 death, and 6 other very bad reactions in millions and millions of doses, over 6 million doses given. So very, very rare.
Always a pleasure, sir. Thank you very much.
All right. Thank you, Jack.
Dr. Kevin Cavanaugh, founder of Health Watch USA.